Well, hello, I'm Emily Bachman, Project Manager with the World Affairs Council of Central Florida. And I'm so excited to be joined today by Dario Rodriguez, an alum of the Department of State's International Visitor Leadership Program. He was actually here back in February, one of our last groups for a project on NGO management. So first of all, I want to thank you, Dario, for joining me for a few minutes just to kind of give us an update on what you're doing and how things have been since you were here. So first, if you want to just tell us a little bit about where you're from, the organization you work for, and maybe just a little more information about the IVLP program you were part of.
Okay, yep, perfect. Hi, Emily. It's a pleasure to be here with you today. Um, yeah, my name is Dario, and I am part of a sexual health clinic, a community-based organization that was initially meant to be for gay and bisexual men, but we opened for all the population. So now we're just a sexual health clinic who helps like all the people who have a STI. So I'm from Guatemala, so it's in Central America. And the NGO management program that I was part of was one of the programs that was intended to build capacities in us to improve our work at the NGOs that we work. We work with sometimes with public funds, sometimes with other organization funds. So they wanted to let us know how other organization works in different places of US, so that way we could bring that experience to our countries and improve programs, strategies, and the management that we're having right now with the organization and with other organizations too. So that was basically what we were doing back in February.
Great, thank you for giving us that overview. And obviously, the big question on so many minds right now is related to the pandemic and how you all are faring. So if you can just talk a little bit about your personal experience with COVID, how your community is doing, how the country maybe is doing as a whole, or anything you'd like to kind of touch on around that.
Okay. Yes. Well, actually, this it is very hard on my country. We were not prepared to handle this situation. The health system in the country, as most of Central America, it's kind of weak. So it's something that has not been invested on for a long time, and now we're just realizing how bad idea was that, because we were not prepared at all. So as part of the organization that I work with, we had to do a lot of changes. We were closed for about a month because we were not able to do anything until the government allowed us to. We have to change a lot of protocols and make sure that if people is going to go to work, they will be safe because they are responsibility. So we have to change the way that we were working with the people. We were used to just receive to anyone who gets to the clinic. We will receive them, and we work until we have no more patients. Well, now it's different. We have to restrict the amount of people that we can receive, and we have also to restrict the amount of people who can be in the clinic at the same time. We have to use protection equipment, make appointments, and have a space between every patient, so we can ensure that we don't have a lot of people and are high risk of getting COVID. And so far, we are very proud that any of our um, collaborators has been diagnosed with COVID or had any of the symptoms. So so far we've been good. And as a personal experience, during the start of this pandemic, the hospital started to recruit people to work with them, and as because of my background, I was reached to work in one of the first COVID hospitals in the country. So during the first 4 months of the epidemic or the pandemic here in Guatemala, I was working at that hospital, helping to build the clinical laboratory and doing not just the COVID test, but all the follow-up that we have to do for all the patients. So yes, I did have a very close experience with the COVID patients during the start of this disease. And actually, I just finished a couple weeks ago my job there. I have helped them with a little bit of volunteer work, because still there's a lot of need there. There are not a lot of professionals who are willing to go and work there. One is because they're scared. Two is because a lot of them are high risk people, or they have someone who is a high risk person on their families and don't want to put in risk to anyone who is too close. So um, I was the one of the ideal people who could go there, because I live by myself with no other people with comorbidities that could have like a very strong impact because of COVID. So I was willing to do it for a while. I finished now my contract, so, and I'm continue working with my the original organization that I work with. But still, there's a lot of job that we have to do in the country. So that's basically
Yeah, I
it.
appreciate you sharing that. That's
Thank you.
we're really impressed impressed by all the work you're doing, and I appreciate you doing that, and thank you for sharing your story. So if you can talk just a little bit about what you saw as your biggest takeaway from your time in the US, or maybe even in Orlando, and what you were able to take back to your organization and use or have used since then, that would be great.
Well, I have a lot of very good experiences over there. One of the ones that I remember the most, um, I know that I am part of the generation of computers and all the geek generation, but I'm actually not that good with that. So social media has something that I've been struggling with. So one of my first experience was a workshop, very good one that we received on Washington D.C. about how to use effectively social media and the impact that it could have on organizations. So it's something that we have been working a lot, and actually it was very useful because right now we are working a lot with the social media, so we can reach a lot of people and share messages and bring information, and also to be in touch with our patients. So this has been really helpful. It's something that I liked a lot. And um, it's not because you're from Orlando, but actually one of my favorite places was Orlando. Um, and it was not just because Universal Studios that I love, but actually I have very good experiences over there. The LGBT community center was a very good experience to know how it's something very similar that we do here with the LGBT center. So I had the chance to have a better view of other places and how they handle the same situations in different ways, how they become self-sustainable, and how they engage community. That gave me a lot of tools and ideas to bring back here. It was very useful to me. And so that was one of my like the best places that I could visit when I was at US. And also Orlando University, they provided with some very useful information about tools. Um, we always have been seen as a community organization that it's just to yes, we do help people, but it's hard in my country for NGOs to see as a scientific organization too. And we are full of people of science. We have physicians, psychologists. I am a biochemist. So we have a lot of people who is very well prepared and that can bring new information for a country. And the tools that they gave us, or they introduced us at the university, was very useful, so we can use the data that we have in a better way, not just for our donors but also for the scientific community in the country, to make improvements to better policies for the people, and even to show how the new strategies that we're applying can be applied in the entire country and have a better impact on the community that we're working with.
Yeah, that's great. I think you made great points, and I'm so glad to hear that you found those tools really helpful. And obviously, when you talk about navigating social media and those kinds of things, that's something we're all learning how to do on the fly a little bit too. So I get that. So just as kind of a final wrap up, are there any, is there anything you'd like to share with us about Guatemala, or anything you wish we knew, or any kind of little tidbits you'd like to leave behind as a last kind of little piece there.
Well, actually, after all this gets to normal again, Guatemala, it's an amazing place to live and to visit. Um, we do have a lot of issues with the government and the public policies in whole Latin America. But to be honest, um, going to the US made me realize how much I like my own country, and I actually loved it. That was my first trip to US. I've been in in other countries, but all from Latin America. So this was my first trip to a country like that, and it was really good. I like it a lot. But I realized how different the cultures and the way of living is, and I realized how much I like the life that I live here or that I used to live before pandemic. So if you wanna know a place full of ancestral magic, very nice people, um, hot weather, and a lot of places to visit, to do, and a lot of weird food, but very good food. You can come here and you will be welcome. And also, I appreciate a lot for all the people that I met in Orlando and how well received we were there. It was like one of my favorite places to visit. And again, it's not because you're from Orlando. I always say that.
We didn't pay
Orlando
you extra for that, right?
was. Thank you.
Yeah, well, we appreciate it, and we really loved having you here. So, and I appreciate you sharing some about your experiences, and we look forward to being able to travel and see more of Guatemala when that's allowed again. So,
Yes.
I want to thank you so much for taking the time to share what you're doing, share what you've been up to. We look forward to kind of keeping up and seeing what you do next. So, thank you so much for being with me today.
Thank you. And good to see you too.